They are the men and women we call during an emergency. Frontline workers who, on any given day, crisscross communities spanning the country to help respond to every medical crisis under the sun. When it comes to the COVID pandemic, the roles for fire and EMS workers have become more urgent and dangerous by the day. Welcome to another edition of COVID Conversations, where each week at noon we bring you the experts to help you make sound decisions for you and your family. I'm Harold Fisher, and this week my guest is John Donnelly, Senior Fire and EMS Chief for the District of Columbia. Chief Donnelly, thanks for joining the conversation.
Well, thanks for having me, Mr. Fisher. It's an important subject.
Absolutely. Let me get right to this. Now, Chief, of course, you're charged with overseeing a department of some 2,100 fire and emergency medical service employees. That includes firefighters and paramedics and staff. Your team is front and center when it comes to the COVID pandemic. Are you seeing a light at the end of the tunnel when it comes to the number of COVID calls you are responding to daily?
Yeah, we are in our community. The call volume for COVID is definitely on the backside of that surge that we saw with Omicron and the one before that with Delta. So that's a predictable pattern. I think we're also seeing a decrease in cases in our workforce. And since our workforce represents our community, it's a bellwether for what's going on as well.
Speaking of the workforce, talk to us a little bit about the toll the pandemic has had on the workforce, not just physically, but mentally. I know that for a lot of large organizations that had to work through the pandemic, uh, it was rough.
Oh, it is rough. It's still rough. And I'm I'm in awe of our people every day. We've asked them to come to work. We've needed them to come to work. The communities relied on them from the very beginning of COVID. DC firefighters were hit from the very beginning with the disease. Um, and all throughout this, they've been coming to work every day. And when you look at what Omicron did, you know, we were all looking forward to light at the end of the tunnel. We were all looking forward to holidays with our families. And Omicron hit, and we had about 400 people out at one time of that 2,100 person workforce over the holidays. And I need 356 people to open the door every day to meet the needs of the city. So we had people that just, through the holidays stayed at work so that you could serve the community. It's our people are the best. They really are. DC's bravest.
Now, we know, of course, that some of the COVID guidelines are being relaxed in the district. Will that be the case for your workers, or will they still be required to mask up?
So we follow the mayor's orders, and we also have some DC health regulations that apply to us. So when you see healthcare workers and regulations that are different for healthcare workers, those apply to fire and EMS.
I see.
But the mask for us, at least in our workplaces, will be coming off on March 1st, and that's something. But it's still tough. It's just a lot of demand. It's a lot of extra personal protective equipment when you're out dealing with people.
Yeah. Now, certainly, as you know, there remains a level of hesitancy when it comes to taking the vaccine. What's the vaccination rate for your department now?
So we have 217 people that have not gotten a vaccine because of either religious or medical exemptions, or applications for exemptions. None of those have really, for the most part, they haven't been ruled on. So it's about 10% of the workforce. We're at like 87%, I believe, is our current figure for vaccinated. And that's the 87% of the people are getting it. It's been good. We haven't had any of those people hospitalized during this last surge, so it's very beneficial in that sense. It's keeping our people out of the hospital.
So, what is the status for those who decline to take the shot without those religious or medical exemptions?
So we have 6 employees that declined without the exemptions or any other reason. Most of them were already in other leave statuses for a variety of discipline or administrative reasons. And we have 2 people, I think, or 3 people, I guess, of those 6 that are working through the process. Because what happened with them is that they lost their license to practice medicine, their
Mhm.
EMT license, essentially. So they're going to go through a disciplinary process that in all likelihood, unless they decide to get the vaccine, will result in them losing their jobs.
I see.
And they haven't been serving the public without the vaccine,
Mhm.
without all the testing protocols that we have in place. They've been off work since about middle of October.
We often talk about what firefighters and the EMS staff can do to serve the community, but what would you say to the public? What can the public do to help keep your workers safe as they respond to emergencies, even as, of course, we see some of the numbers declining in the district?
So I think that being conscious of your health and leading a healthy lifestyle at the beginning of the day is one of the most important things.
Okay.
Um, we have a lot of, and it's understanding the system. So for us, our firefighters and our EMS workers are all the same people. They're not separate.
Okay.
They do one in the other. So we all come to help you in different ways, shapes, and forms, depending on what you need at the time. Um, you should know about our system that we do other things besides take you to the hospital. We have a nurse triage line. And the nurse triage line, if you're not uh, very critically ill, means that we can set you up with a doctor in your community and help introduce you to some primary care. That's really important. You may be able to talk to a doctor on the phone and avoid going to the hospital. There's a lot of other things besides being in the emergency room. That's a really hard way to get medical care. And that's something we have to do better in our community. But the second part of it, in terms of this conversation, is um, at our ICUs. I'm going to use an example. Our ICUs, the intensive care units in our hospitals, are not overflowing. They don't have. They're not overflowing with vaccinated COVID patients. They are overflowing with patients that didn't get the vaccine. At the end of the day, that's the most important thing we can all do right now is to get the vaccine. Let the people that are having heart attacks, strokes be seen in the ICU instead of people who didn't get boosted or get vaccinated or boosted.
The other issue that the city is facing, and your department has also been impacted by this, is what some may call a twin pandemic, COVID and violence, deadly violence. How are both of these impacting what you do every day?
So the violence is really hard. Um, we see it in our communities, and for a good portion of our workforce, they see themselves in this violence. And the feedback I get from people is that it it feels personal, um, and it feels senseless, and everybody's frustrated across the board when we start trying to figure out what can we do to help, right? What can we do? And you hear great stories about firehouses being mentors for people, teenagers that stop in. And we had a kid at School Without Walls during the opening of Engine 23 in Foggy Bottom that said the firefighters just talked to him about their car, and it gave him an idea about other things he could do. um, and I think for us, maybe it's little steps that we can make a difference in people's lives, and by leading and showing who we are and that we're there to help. But this is going to take a lot of time to turn around, and it's going to be a long struggle for everybody in the government.
You mentioned before we came on, of course, you are on the scene of a deadly fire, and you talk about, not just today, but frequently, about fire prevention. And I think I would be remiss if I didn't give you an opportunity to speak briefly about that particular message, whatever that message happens to be. for, for the public. We are still in winter, and there are all kinds of things I think that you may be able to share with us that would be helpful.
So I really appreciate the opportunity to share this message. The people that are dying in fires in our community are vulnerable populations, meaning our senior citizens, your grandparents, and a few children under 12. Healthy people between the ages of 12 and 60 are very safe from fire in the community. We have a lot of smoke detectors. We'd always like more, but the idea here, the most important fire prevention message is to take care of your neighbors. Make sure that if there's an elderly person there, that they're in a place that's safe for them, that there isn't materials piled around their stoves, that they're not overusing extension cords, that their smoke alarms work, that there aren't obstructions in the way that keep them from getting out of the house. And if you need help with that, if you dial 311, you can make an appointment for us to come help the senior citizen with that, or anybody that needs it, even if it's your house and you're not a senior citizen. We'll come out, we'll point out some things that might make you safer and hopefully avoid these problems.
Yeah, that 311 number for non-emergency but important communication with the city, and more specifically fire and EMS, really, really important. I know that has been an issue not only in DC but across the country, where people are so quick to use 911 for
Yes.
non-emergency things.
Yeah, we've spent 35 years telling people to call 911 whenever you feel like there's something not right. And I think as our communities have grown, it does create some stresses. So 311 is a great alternative.
Chief John Donnelly, Senior, DC Fire and EMS, I want to thank you so much for spending some time with us to talk about these really important things. Please stay safe during the course of the pandemic and continue the work that you're doing to keep the community safe from fire and other emergency health issues. I really appreciate your time.
I appreciate it. You got time for one more thing?
No, please. Absolutely.
Sure. 82% of the people that die by cardiac arrest outside of their homes in the District of Columbia are African American. We can help improve survival rates by everybody learning hands-on heart CPR. The fire department will come to your church. It will come to your community. It will come to your homeowners association, your ANC meeting, your child sporting events. Just invite us. You can use 311 to reach out to us to do that. But hands-on heart takes you less than 2 or 3 minutes to learn, and you can save a life with that. And it's very important to us to save lives.
I didn't know that. Again, good information to get out there. That's something that we don't hear a lot about, and I'm glad to know that those resources are also available. So again, Chief John Donnelly, thank you so much, and please be safe.
Thank you. Appreciate the time.
Absolutely. Thank you for joining us for COVID Conversations. It's Straight Talk every Wednesday at noon with trusted experts to help you make informed healthcare decisions for you and your family. I'm Harold Fisher. Have a safe and healthy week.